In other news, India has reported 2 cases of human metapneumovirus, also known as HMPV, both in Bengaluru. A 3-month-old baby who has been discharged and an 8-month-old infant who is recovering at a hospital in Karnataka's capital Bengaluru have been diagnosed with HMPV. Karnataka has not given any confirmation, but the health department sources say that they will send the infant samples to National Institute of Virology in Pune. Now, concerns over HMPV began after China's Disease Control Authority recently piloted a monitoring system specifically for pneumonia of unknown origin, anticipating a seasonal spike in infections. India had earlier urged the World Health Organization, WHO, to share timely updates. In a statement, however, India's Ministry of Health and Family Welfare informed that the Indian Council of Medical Research, ICMR, has already put a strong surveillance system in place to monitor influenza and severe acute respiratory illnesses. The ministry has urged the citizens to follow certain do's and don'ts to protect themselves and prevent the spread of the infection. The ministry has advised people to cover their mouth and nose with handkerchief or tissue paper when sneezing, wash their hands with soap and water or any alcohol-based sanitizer, avoid crowded places, stay at home and limit contact if sick. Also, drink plenty of water and eat nutritious food. Further, the ministry has advised people against reusing tissue paper, coming in close contact with sick people, frequently touching eyes, nose and mouth, spitting in public places, self-medicating without consulting the physician as well. Earlier in the day, there were reports of a major rise in HMPV cases in recent months in Malaysia. In 2024, Malaysia saw 327 HMPV cases, which is a 45% rise from 225 cases reported in 2023. And India has recorded 2 cases of HMPV viruses in children under the age of 1 in Bengaluru. While the Karnataka Health Minister has made it clear that there's no reason to panic, India's Health Ministry has also released a statement a few days ago saying that the case is nothing unusual in China and that there's no reason to panic. Well, for the latest, our correspondent Prasob DA joins us on the phone line. Hi Prasob, just a short while ago we were talking about the first case and now there are 2 cases of the HMPV virus recorded in India, and that is in children under the age of 1. While there is no clarity on whether the virus reported in China and the strain found in India are related, tell us more, get us the latest on this.
As we speak, Karnataka Health Minister is chairing an emergency meeting regarding HMPV virus. So, in the meantime, Health Ministry has also issued do's and don'ts. And also, Health Ministry has taken 2 cases very seriously in Karnataka. They have sent samples of blood samples of the patients and also family members to Pune's Virology Institute to detect what kind of variant of HMPV was there or is still there with the family or with the children. So as of now, two patients have been detected with HMPV, while one was just 3-year-old month, the female child, and thankfully the child has been discharged and all the symptoms have been treated, and she is doing right now perfectly according to the hospital sources. And also, right now, 8-year-old month baby is also being treated in the same hospital in Bangalore. But the symptoms are being treated and she is responding well to the treatment, says the doctor. But the main issue is the Virology Institute must confirm what kind of variant is present with the 2 samples which they have got. Because Malaysia and China is seeing huge spikes Health Minister and also Karnataka government is also concerned whether the same strain is there in Bangalore, or is it the existent HMPV usual virus which usually comes during winter season, usually after the December second week, and which is persistent till January last week. So is it the normal virus which can be treated in normal clinics, or is it the strain which we are talking about in China or Malaysia?
Right, Prasob. The Health Ministry in India had earlier reassured the public, stating that the current condition, it does not alarm to any kind of panic. Talk to us more about the precautions and the steps that the officials are taking to track the situation. Like you just also mentioned, Karnataka's Health Minister has said that there is no reason to panic or worry at this point of time.
Yes, Dinesh Gundrao has also mentioned that this is an existent virus which health officials or the doctors have been seeing this, or they are treating this HMP virus for a long time. So health officials know how to treat this. And also, for a better clarity, Karnataka government has issued some do's and don'ts. If we focus more on don'ts, it clearly says do not reuse of the tissue paper or the handkerchief which you use. It should be washed or thrown away, the tissue paper, and also close contact of people and spitting in public. And self-medication without consulting the physician. This is the biggest health concern which Karnataka had seen during the COVID days also. Mainly the self-medication without consulting a doctor or a physician. So to battle this, the Karnataka health government is chairing an emergency meeting right now as we speak, and sources have said this meeting can go on for a long time because they are connecting with government of India, and also they are taking the WHO's guidelines also how to implement this in Bangalore.
Right, Prasob, thank you for joining us on the show with your insights. We'll of course be tracking this very closely with you. And for more on this, we were earlier joined by Dr. Sushila Kataria from New Delhi. She's a senior director at the Medanta Hospital and also a public health expert. This is what she had to say on the HMPV virus recorded in India.
HMPV or human metapneumovirus infection is one of the common respiratory infections. It's not a new virus. It's been there in circulation, was detected first in Netherlands in 2001. And it is an RNA virus, and you're right that, the advisory is more or less similar to COVID or any influenza-related infection, because it's a respiratory infection, spreads through droplet infection, close contact with the infected person, and also from the contaminated object touched by the infected person. So, and few, sporadic cases here and there in different parts of the country, Hong Kong, China, Malaysia, and Pakistan, and all this have been happening since 2001. So it's not a new virus. It's been in circulation, and it is estimated that every 10th person during this part of the year, like when the winter is receding and spring is about to come, is related to HMPV infection. So there could be other more number of cases in our country also, but when we test it, we do it when a PCR will be done, we'll see it. But by and large, it is a mild infection. It is more of a pediatric infection, like it affects children less than 1 year of age. And hospitalization is also very common in children, but it can affect adults, and they may require hospitalization, especially if they are senior citizens above the age of 65 years or harboring some comorbid medical condition. But I'd like to say that, yes, it's usually a milder infection and gets better spontaneously with symptomatic treatment.